Dr. Joe here. Another comment on the fact that vitamin D deficiency ups general death. So in other words, if you're low in vitamin D in terms of blood counts of what D levels are, this means that you have a greater likelihood of dying, mainly from cardiovascular disease. They didn't find any evidence that had more cancer. This is from the Archives of Internal Medicine just recently, and it does tell us a little bit about how things work in terms of cardiovascular disease. But once again, they don't give any situation other than an observation that if you are in the lower quartile of vitamin D values in the blood, you have an increased chance of dying from cardiovascular disease, and that's all. But as we go through, we're finding more and more reasons to think about how supplementation, which they didn't talk about, occurs. Back when I was starting endocrinology in 1965, frankly, I found that I was a little startled that everybody in endocrinology was using very large amounts of vitamin D. They were treating disease, of course, but that's what we did. Now that everybody feels they have a leg up on vitamin D and knowing just exactly what the dosage should be or shouldn't be, we have a very, very difficult situation of figuring out exactly what to do. But the overwhelming thing to know is vitamin D in virtually any situation will not cause toxicity unless you take calcium with it. And unless you have some other reason to think that you should have calcium with it, I would be very, very careful. We've never really seen anybody get toxic from vitamin D.